Hello, how are you? Miss Josant, can you hear me? Can you hear me? That thing must be. Hello, can you hear me?
Yes, Professor, I can hear you.
Okay. How are you doing today?
I'm good. How are you?
Doing well. So we'll
Um,
go ahead. I'm sorry.
some of my other classmates are trying to get in, but the thing that our teacher sent us with the Zoom for the review, it's not working. So I'm trying to tell them like to go um to the one where they had sent us for Martin Luther King, where all the others Zoom were there because the one they sent us for, it's not working. So give me 1 second, okay?
Yes, it's the one we use for class.
Yeah.
Yes. Thank you for letting me know that. And yeah,
Mhm.
we'll wait on them.
Okay.
So good evening. Go ahead and type your name and your campus in the chat. These sessions are recorded and they are viewed, by administration. So
Yeah, it's Elise Mem, it's
So good evening to everyone. We're waiting on some others that are trying to get in. But while we are waiting, make sure you turn your cameras on. Go ahead and type your name and your campus in the chat. And if you are from another professor's class, put the professor's name also in the chat as well. Just as a reminder, these sessions are recorded and we will provide the link for you to review. And we're a week out from, well, really 2 weeks because it's not until next Friday. So you'll have two more reviews that you can participate in after this one, two more live reviews, but we will share the links so that you can go back and review as much as needed. So good evening, everyone. Go ahead and place your name, your campus, and if you are not in my class, place your professor's name in the chat as well. We'll give it 3 more minutes. We know some had trouble getting in, and then we'll get started. But just tell them no fear. They'll have the recording. I'll provide the link just as soon as it converts over in my YouTube. So 2 more minutes and we'll go ahead and get started. Okay. It is 6:10. We will go ahead and get started. Again, remember to type your name and your campus and your professor's name in the chat. These sessions are recorded. After they've converted, after I place it in YouTube, the link will be shared. So it is interactive. We will be reviewing our concepts and just narrowing down the content. So feel free to share, ask your questions. And I have like a PowerPoint that's going to guide us through. So let me just go ahead and share. Hope everybody's doing well tonight.
Doing good. How are you doing?
All is well. Thank you. Okay, I'm going to I put some little designs in here. Sometimes the designs mess up what you have on there. So I'm going to try to go with my little designs. And of course, we're reviewing the concepts. Information is not new, but I'm just narrowing down your understanding and what's going on with a disease process and treatment for it. So before we begin, remember when you're taking an exam, you want to read through the scenario, the question, the scenario that's there. Identify the concept, whether or not it's asthma, scabies, ADHD, what lead poisoning, level of intervention. Identify what is the question that you really have to answer before you go and make your selection. Because sometimes, there's a lot of fluff and some added information in that question. But then when it comes down to the question part, it's talking about something that might not necessarily be what you read prior to reading the question. Pay attention to those keywords. Priority. When you see priority, more than likely, all of the answer choices are going to be correct. But you need to identify what should be done first. So when you read the answer choice, like, oh my goodness, all these, they look correct. They probably are, because the question is asking you priority. So which of those answer choices should be done first? Another example, pay attention to the key words and key phrases. If the question asks you, how do we know teaching was effective? So when you read the answer choices, are you looking for something, answer to our response that is correct or incorrect?
Correct.
Okay, good. So if the question asks you, which statement indicates that further teaching is needed? Are we looking for something that the patient or the family member is saying that's correct or incorrect?
A negative answer. Incorrect.
Say that again.
It could be negative or incorrect.
Exactly. Negative or incorrect. You can think of it like that. Yes. So identify the concept that the question is really asking you about. A scenario, they're talking about all these different interventions, but when it comes down to the question, it's asking you to identify the tertiary prevention. But they've given you in the scenario, they've given you all different types of interventions. So identify the concept and look for those keywords or phrases. All right, so let's move on. So asthma, we know asthma is what? What we know about asthma?
It's a chronic illness.
Asthma is a chronic illness, is like cause bronchospasm, more likely on children.
Okay, so it's a respiratory disorder that affects the airways, the lungs. So even if you have to go back to the basics, which body system is mostly affected by this disease process? To take it a step further, you identify the body system, respiratory. Well, what is the respiratory system supposed to do? What are those functions of the respiratory system? And so that helps narrow down your focus and ensure that you understand what the topic is or the concept is. So yes, that was correct. So for some important concepts about asthma, we want to try to prevent asthma attacks because we want our children to be in school for those days. We want them to be healthy, to stay in school, to attend school, and then stay the entire day. So in order to be proactive, we need to identify triggers of those asthma attacks. And we know that it's different for different people. It could be pet dander, it can be smoking, mold, different things can trigger that. Now, we do want to encourage, if we're providing educational program for the parents, we want to discourage them from having carpets and drapes in the child's room that has asthma, because those are just known things that kind of hold onto like dust and particles. And then, so if the parent does not have carpet or drapes or any type of upholstery in the child's room, then it lessens the chance of an asthma attack. You know, they might want to use HEPA filters. They might want to use humidifiers. The child should not be excluded from PE. If a child, not everyone has exercise-induced asthma, but if a child has exercise-induced asthma, what should more than likely the doctor do or prescribe in reference to their inhaler? What should you expect to see? Administer the inhaler when?
Before the exercise.
Before, exactly. So remember, our goal is to keep the child as healthy as possible so they can run, jump, and hop just like the next child. So we want to identify those triggers, and we want to exclude things, and they just have to just do without the drapes and the upholstery and the carpets in the room. And then if it's exercise-induced asthma, pre-treat before the exercise. So we know smoking is harmful, is proven harmful to children. And so some people, you know, the new trend is the electronic cigarettes or the vaping. But what we found out, well, what they're finding out is the electronic cigarettes or e-cigs are are more harmful than regular traditional cigarettes. So even if the child, the parents is, well, I don't vape in the house, and they have the tools or the device, the e-cigarette device or the vaping device, and the child touches that device and that oil is absorbed, it is toxic to the child. So you want to advise the parent on the harmful effects of the e-cigarettes and just creating a smoke-free environment for the child. Again, eliminating those triggers, those allergens. So obesity is another big one. It was President Obama's wife, Miss Michelle Obama. That was her initiative. It was like, I think it was called Let's Get Up and Move. But obesity is a huge risk factor, and we're seeing it, you know, in our children now. Why do you think we're seeing obesity rates are soaring in our children? What are they not doing much of?
Going outside to
Exactly. You know, let's go outside. That was the thing. But now they have these devices. And so it's not popular because all their entertainment is on the device. So they're not getting up and moving. So we want to encourage the physical activity and also encourage a diet that follows the food pyramid. Avoid sugary snacks and including the 100% fruit juices, because what they're saying that those are empty calories. So be careful with the 100% fruit juice. So we know adolescents, each age group has different factors that they're at high risk for. But adolescents, they're at a higher risk for violence. So if you have your 11th and 12th graders coming in, you're the school nurse, and you know, they'll share a lot of things with you. And they're telling you about this new relationship. And you might want to ask some probing questions just to ensure that that person feels safe in that relationship. Because we do know with the adolescents, the risk of violence is high, victimization is high. So we want to ensure, you know, just have that establish rapport with any of our groups of community members, of our children. We want to establish rapport and that trust so that they will come forth with information in the event that there's something they need to tell. So what's important from this slide is adolescents, they're at high risk for violence. So you might want to engage in conversation and probe a little bit more just to ensure that they are in a safe relationship and they're not being abused. This slide should have really went after my obesity one, but yes, we just talked about this. Children, they're recommending 30 to 60 minutes per day of physical exercise. I mean, our children now are not even getting that much in a whole week, but per day. So the American Academy of Pediatrics, they are recommending no television. Wow. smartphones or computers for children under the age of 2, and then less than 2 hours of screen time per day for children and teens. Wow, this is just not happening. But then that's why we see certain things. For example, the obesity that we just talked about. So this slide, we want to encourage the physical activity, which is what we just said. Bullying or abuse, while students seek assistance from the school nurse for illnesses or injuries, sometimes that child will come to you the same time of day, complaining of the same stomach ache or their finger hurt. And you've done your head to toe assessment. You have assessed, and you just really can't quite put your finger on it. So ask that established rapport, ask that probing question. Hey, is it something else that we need to talk about? Is it something else? What happens before your finger starts to hurt? What happens before your stomach starts to hurt? And you're just you're still acknowledging why they said they were there, but then you're asking that more probing question to get more information, because you want to recognize what's really going on. It could be a classroom that they're going to. It could be, because I know in our schools we had times when we went to lunch and when we went to the restroom. We were on a time schedule, and so it could be that class that child is in, and they're having a beef or some kind of disagreement with another child that's in another class, and they eat lunch at the same time. So you want to try to establish rapport. Don't dismiss what they're saying, but just say, hey, I just need a little bit more information. What is occurring before you come in? Where are you at? So that you can just ensure that bullying or abuse is not occurring. Most schools do have an anonymous line or app. I forget what the name of that app was, but where you can report it. But we know bullying, cyberbullying is a real thing. It is real. So we do want to establish a report and then ask more questions to find out more information. So families, we do know that financial stability or socioeconomic status plays a huge role in families. If a person cannot, for some reason, cannot access, finances, then it kind of, throws a domino effect. They don't, more than likely, they're not going to purchase health insurance. More than likely, when they go to the grocery store, I know funds are limited. If I have to choose between this food item and that food item, I will choose the food item that is going to, be a lesser a cost, which might not be the more healthier food choice. So the greatest impact of a child's overall health is the financial stability or socioeconomic status of the family. That's the key point from this slide. We want to identify our own beliefs and also be respectful of the families. You want to identify resources that the family can use, utilize in order to help offset some of that financial instability. All right, so tell me, what is scabies, you all?
Skin infections.
It's a skin infection. It is where the parasite, what it does is gets up under the skin, just up on that first layer of skin. They call it burrowing. It just goes right up under that first layer of skin, and it causes intense itching. And it is contagious. It's contact. If you come in contact with it long enough, you can end up with the scabies, the parasite, on you. More than likely, if the person that has scabies and they live in a household with someone else, everyone, and you can't really see it, but all family members should be treated, even babysitters, whomever, they must be treated, because it is just that contagious. Linens and clothes should be washed and dried at high heat. For stuffed animals and non-washable items, they should be bagged and stored for at least a week before anybody else comes back and have any interaction or with that stuffed toy or non-washable items. But the key thing is, everyone must be treated. Even if the babysitter was just there for an hour, everyone must be treated. And they use an anti-parasitic. For the most part, it's this lotion. It's called what was the name of that lotion? But you have to put it on from your head to your toe. You let it stay on for a certain length of time. and you wash it all off and you have to put it on again. It's a strict regimen that they give you for treating the scabies, because it gets right up under the skin. I tried to put a picture so you all could just kind of see it, but it's just like little burrows. Okay. So for ADHD, what do we know about ADHD?
It's a, it's a, my kids are making too much noise. I cannot. Sorry.
Okay.
Yeah, it's kind of like a ghost motor skill, like make the kids impulsive and make them like really cannot focus sometimes for a long period of times in school, or they need some period of break, stuff like that.
And that is correct. We need to understand that it's a neurodevelopmental disorder. And because of the impulsiveness, they have trouble paying attention. We need to, as a nurse, recommend maybe to the teacher and or the parents that child needs that child needs breaks, and remind the child to take their medications, to report to you to take meds. So yes, those are the key points from that. You're correct. They will need frequent break periods. They don't need to, the work don't need to be changed, but it needs to be broken up. The time frames where they may have to have more breaks than the other students, and encourage them not to miss the medications. Come see you if you're the school nurse so that they can take their meds. The other thing about their medications too is they found out those medications decreases the child appetite. And so the child might have to have a plan where the parent supplies them with extra snacks in their book bag, and or in some schools they can offer different food choices, because like I said, what they found out with those medications, it decreases the child appetite, and so they're growing, so they still need all the nutrition, and because they're a growing child. So that might be a conversation that you will have to have, or some type of meeting, to help create that plan and identify some interventions that can help offset if the child is not eating the meals like they should. So eczema, tell me what that is.
It's a skin condition that's usually um show up like a rash, dry skin. It'll be like sometimes it hurt, but not all the time. So sometimes it can be inflamed and sometimes it'll just look dry.
Okay, that's correct. And usually the person experiences that intense itching. And you as a nurse we might have to administer an antihistamine. And they also you want to identify triggers. You want to keep the skin lubricated. But the key thing is you might have to administer antihistamines just to help with that itching. Because if they itch, they start to scratch, the skin is open, and here we go, at risk for infection. So if you can get that itching under control, that scratching, so that the skin is not broken, you can alleviate a lot of problems. Okay, so lead exposure. What do we know about lead exposure?
Um, I forgot what year was it, but I think it's a house that built in the 1960s, I think was it? Um, where there was a lot of leads happening. So now when the doctor, whoever it is, checking for lead, they just ask you like in what years your house was built in, so they can figure out if that's gonna be an issue or not for like lead.
Okay, let me respond to Professor Marvel here. Okay. So yes, before, I can't remember that year either, but it was okay. It was the norm to use lead in paint. But what they found out is lead is harmful to the body, especially a growing child. It can lead to attacks of brain on the brain and the nervous system. It will prevent the child from growing properly, and they will have developmental delays. And so when they found that out back whatever year it was, the routine was the child automatically, when they came in for their well baby checks or well child check, they automatically did a lead test. But now they've kind of gotten a hold on it. They have identified homes and they have come up with interventions of getting that lead paint out of homes. So what they do now is for the child, they do a survey. So when they come in, they ask them questions. You know, is your paint chipping? You know, what how old is your home? And then from those assessment questions, then they'll decide whether or not they need to do a lead test. But lead is in fact harmful to the body. And so, like I said, once they found that out, they pulled lead out of a paint. And I want to say it is, and it's not for this purpose right here, but lead was also in, I think, the gas that we would put in our vehicles. But now, like I said, once they realize it, it's not in gas either. But lead exposure attacks the brain and the central nervous system. It can cause developmental delays. So usually it can be identified if there is chipping of the paint. There's the buildings are deteriorating, and you can see that just the paint is flaking. Okay, so scoliosis. What do we know about scoliosis?
Scoliosis is a S-shaped curvature of the spine. Sometimes make you cannot really see it if the kids like they say it's not really show up like that when they grow up, but you can most of the time see it when they bending or when they standing in front of you. You can see one arm longer than the other one. That's how you can really see it when they bend in front of you, stuff like.
Exactly, and that is how it is assessed. They have the child to and I'm gonna share my screen back in a minute. I'm trying to send back out my Zoom link here. So scoliosis is that curvature in the spine. New email. And it is identified by just having the child to bend over. And you will see that the spine does like that S. So let's see. Okay. All right. Let me pull up our slide again here. Zoom and share. Slideshow. From current slide. Okay. So scoliosis is a sideways curvature of the spine that most often is usually identified in your school age children, because that's one of those checks that they do. They do the check for the head lice and the scoliosis. And this is what you do. You have the child, ask the child to being forward at the waist, and you want to observe the child's back for asymmetry. Another key point is functional scoliosis usually is caused by poor posture. It's not a spinal disease. So that's another key point that you want to remember. First of all, how do we identify if that curvature is there? We have the child to being forward at the waist and observe for asymmetry. And then functional scoliosis is usually caused by poor posture. Remember your grandma said, sit up straight, stand up straight. You know, we always want to just kind of like do that little swag. And so we oftentimes catch ourselves, you know, sitting up straight. But that functional scoliosis is caused by poor posture. So preventing infections, that one thing that they say that's most important is what? To prevent infections.
Wash hands.
Washing those hands, exactly. We want to clean surfaces routinely. We don't want to cross-contaminate food when we're, for example, we're cutting up food on a cutting board, and then we place some produce, something else on there that's not a meat item. We don't want to cross-contaminate, and we do want to cook foods at the appropriate temperature. But the most effective is washing those hands, keeping your hands washed. You can never wash them too much. Wash your hands before and after coming in contact with anything before and after prepping food, before and after using the restroom, doing dressing changes, ongoing, washing those hands. Gun violence is a risk factor for accidental injury or death among children. So when you're sitting down and doing that head-to-toe assessment with that family, there's some things you want to identify. If the parent wants to, they want to have a gun in the home, you need to talk about gun safety. They need to identify, like, where is the gun? Is the ammunition and the gun stored in the same place? Is where they have the gun or the ammunition stored, are those places, are they locked or unlocked? Who has the key? Where is the key? So you want to go over a safety plan for them, and you want to identify where these firearms stored at. First and foremost, you want to identify where they are stored. Okay, levels of prevention. So tell me, what are the 3 levels of prevention?
Primary, secondary, tertiary.
Okay, so what is primary? You were giving me a definition of paraphrasing. What is primary?
Primary is trying to prevent the problem before it happens.
Exactly. Preventing before it happens. What about secondary?
Like screenings?
Screenings, remember, we're those little detectives. We're trying to detect, screen, identify if there's a problem. So it's taking it a step further. What about tertiary? What is tertiary?
It's already happened, so now we're trying to take measure to fix it.
Control it, maintain it, so and so it won't get worse. Manage it, all those buzzwords. Yes. Okay. So we just said primary prevention addresses the use of interventions before the disease occurs and to reduce the risk of it actually developing. That's where you would design your gun safety program. You sit down with that parent and say, hey, first off, we need to identify where these guns at. We providing education about prevention of obesity. We're providing a get up and move physical activity program before obesity sets in. Secondary prevention is aimed at detecting real detectives the disease early through screening. Secondary prevention activities involve screening activities that allow for early recognition of the problem. And then tertiary, we said that the disease or the injury or the deficit is already there, and we're just trying to manage it, maintain it, prevent it from getting worse. And that can include taking medications, oral, injections, going to physical therapy so that the person can get back to their norm with walking. And a disease or injury or deficit is already there, and we're trying to control it, improve it, and so forth. All right, so levels of prevention will be on all of the exams. So remember, you have to apply what you know about the different levels of prevention. So the definition you're understanding, you need to be able to apply it to some scenarios, because the question is not going to ask you, what is a primary prevention? There are going to be some examples and you have to identify it. So I have some here on the screen. So let's just take one at a time. The first one, the nurse teaches a child who was recently diagnosed with type 1 diabetes to check their finger stick or a glucose level. Which level?
Tertiary.
Okay. The disease process is already there, and we're trying to help them to maintain it. so that it won't get any worse. So they can maybe adjust their, because if they're on a sliding scale, it will, that finger stick result or that glucose stick result will determine the amount of insulin that they will have to take. And also the glucose sticks, the doctor may ask the person to do some random finger sticks so that they can adjust medications. So yes, the disease process is there and we're trying to manage it or prevent it from getting worse. The nurse teaches a child who has diabetes to take responsibility by giving injections to dolls or puppets.
Sherry.
The nurse teaches a child who has diabetes to take responsibility by giving injections to the dolls or the puppets. So what I'm thinking is happening is the child is of age and can accept that responsibility to start doing self-injections. So to prepare that child to help manage the disease process, which is diabetes, so it won't get any worse, the nurse is teaching the child to do self-management by using the dolls or the puppet to do. Back in the day, we used to use oranges, but now you can just use a doll because you can find a little teddy bear with a little soft, and you can inject the needle inside of it. So which level of prevention is this?
Tertiary.
Tertiary.
It's tertiary. There is a disease process, and we're trying to manage the disease, trying to prevent it from getting worse. So take what you know and apply it to that situation. And you might want to talk yourself through it. Wait a minute, there's a disease process, but the child is giving injections to a doll or a puppet. Remember, we're trying to manage it, prevent it from getting worse. Good. A nurse advises a client diagnosed with an active communicable disease not to donate blood, plasma, or organs.
Tertiary.
Yes, there is a disease process there. It didn't name which one, but yes. So we're trying to prevent other people from getting sick. So there's an active communicable disease. And so we're advising that person that has a disease process not to donate blood, plasma, or organs. Okay. The employee health nurse knows that it is one of his or her duties to offer the staff yearly TB screenings, the TB skin test, or the PPDs. What is that?
Secondary.
We see that word, screening. We're trying to detect. So that's correct. Good. So take what you know and apply it to the situation. Yes.
For secondary.
Secondary.
So for secondary, it's the disease doesn't occur yet. They just try to do some research to see if it's there or not, right?
Exactly. We're screening. Remember, we're detecting or screening for secondary. So we're just giving the TB skin test to see if the person reacts to it.
Okay. Thank you.
Mm-hmm. We're not saying that they have TB. We're screening for it. And for that screening, you have to actually do the injection, like right up under the skin. They call it a tuberculin test. It's an intradermal injection. So what about if? Go ahead. I'm sorry.
No, I say thank you.
Okay, you're welcome. So some of the answer choices, remember we look for those keywords. Remember we said screening. This particular scenario had the word screening in there. So, screening, detecting. So screening for hepatitis A.
Secondary.
Secondary. Even though a disease process is named, we're not saying that they have it. We're screening for it. Okay. That word screening is there. All right. The school nurse is asked to attend the PTO or that parent teacher organization that they usually have at most schools monthly. The nurse task, your task is to provide an educational program about injury prevention. Which level of prevention is that?
Primary.
Primary. So with injury, yes, it's primary. Injury has not happened. We're trying to prevent injury. So you go up on the stage and you give your presentation, or you create a handout or something for them to take home. So the next one is non-pharmacologic management of back pain.
Tertiary.
Why is it tertiary?
already have?
Because they already have the back pain, they try to manage it non-pharmacology before they
Exactly. Don't let non-pharmacologic throw you off. The disease process or injury that's there is back pain. If it was obesity, back pain, that's a disease process or injury. It was a broken leg. And we do know that some interventions are not medications. Some interventions are therapy. So a non-pharmacologic management of back pain, that's correct. That's tertiary. Okay. The nurse asks the caregivers how they are coping. The nurse identifies problems early so that interventions can be employed to limit the extent of stress, thus paving the way for improvement.
Secondary?
Secondary.
yes.
So because we're screening. Exactly. Educating the caregiver on stress. I need to rearrange that. And burnout, teaching stress reduction techniques.
Primary.
Exactly. Screening for anxiety, depression, neglect, or abuse.
Secondary.
Secondary.
Okay, great. All right, so are there any questions about anything that we have reviewed? There are always 50 questions. The study guide, it has narrowed down the content. It has narrowed down the concepts. There are 2 more live reviews. All of the live reviews, we'll have recordings and we will share those in the classroom, no matter whose course that you're in, whose class that you're in. That will be shared. You still have, because you all don't test until next week. So we still have enough time in the event that you need some one-on-one time with your professor. Contact us more than likely via email or either text message so we can set that up. And most of the time, I know with me, it doesn't have to be via Zoom. We can be on the phone for a few minutes, and it's better anyway, just do a little few minutes at a time, just review some concepts and just throw out some questions, and just to make sure that you are able to apply what you know. Because most of the time, it's not that you do not understand the concept, it's applying what you know to answer the question that's being asked. So reach out to your professors if that's what you need, some extra time, and just be looking out for those other reviews. Ensure that you have placed your name and your campus in the chat and also your professor's name. These recordings are shared and are viewed by administration. And that is it for tonight. You all have a good evening. And just as soon as my YouTube converts this over, I'll share this link with the other professors and they'll push it out to the classrooms.
Thank you. Have a great night.
Thank you.
you.
You too. Melody, did you get a chance to put your name in the chat?
No, I'm putting it in now.
Okay. Yeah, I was waiting on you. Okay. Are you able to turn your camera on? So for the record, you had your camera on at some point. Okay. Were you able to type your name in? Got it in? You did. Okay. All right. Have a good night.